we have ways to prevent spillovers of viruses through protecting forests, through reforesting certain areas, through improving how we raise farmed animals. And so that's an example of a way to prevent outbreaks of diseases, which is good for people, but it's also good for the planet. And on top of that, it improves equity, right? Because all too often, when we wait for these outbreaks to happen and we have to respond with vaccines and medicines, the people who are in greatest need have least amount of access to those vaccines and medicines. Whereas when you prevent the outbreak from happening at all, everyone benefits everywhere, particularly the people who are most marginalized.
Welcome to the Mongabay Newscast. I'm your co-host, Mike DiGirolamo. Bring you weekly conversations with experts, authors, scientists, and activists working on the front lines of conservation, shining a light on some of the most pressing issues facing our planet and holding people in power to account. This podcast is edited on Gadigal land. Today's guest on the newscast is Neil Vora. Neil is an infectious disease expert turned conservationist. His long and storied medical career took him to the African continent, where he helped combat the spread of deadly diseases like Ebola with the CDC. Eventually, Neil became increasingly drawn to protecting the natural world as it became apparent to him how strong the connection is between environmental degradation and the increase in zoonotic outbreaks. Now, this is a topic we've covered on this podcast before. However, Neil has a different take on how the global scientific community can affect change. I expected Neil to provide expert insight into how deforestation leads to more pandemics, and he certainly did. But I did not expect him to highlight art and philosophy as the missing link to inspiring global change. And I have to say, he makes the strongest case for the power of storytelling I think I've ever heard. Neil, welcome to the Mongabay Newscast. It's great to have you with us.
Thanks so much, Mike. It's great to be here.
So you have a really, really interesting background. So before we dive into talking about disease prevalence and deforestation, can you just tell our listeners how it is that you came to do what you're doing now? Like, you spent a decade working with the CDC, so tell us your story.
The story begins from my childhood. I've always loved animals and nature. At the same time, I learned about public health from a very young age. Growing up, I would look at my father and I understood the significance, the impact that infectious diseases can have on people's lives. Because my dad had smallpox as a kid when he was in India. He survived, thankfully, but smallpox is a deadly disease. It kills sometimes 30% or more of the people that it infects. But my father survived, which is why I'm here today. But growing up, I would look at him and I would see the scars that it left on his face and other parts of his body. And it was a reminder of the impact that infectious diseases can have on people's lives for a long, long time. And my dad was the one who told me about the CDC, the Centers for Disease Control and Prevention. And when I was around 14 years old, I watched the movie Outbreak, and I instantly fell in love with the idea of wearing a hazmat suit and fighting dangerous diseases around the world. And so I ended up going to medical school and then did a residency and then joined the CDC, where I helped fight outbreaks of viruses that originate in animals and that then jump into people. That's called spillover. And so I did that with the CDC. I fought Ebola, rabies, pox viruses. I led New York City's COVID contact tracing program. But again, my other big passion has always been animals and nature. And I wanted to do more to protect nature while also promoting human health, which is why around 3.5 years ago, I left CDC and joined Conservation International.
And that's a really interesting switch, and we're going to dig into that a little bit, because you mentioned in a couple of talks that you gave that you were discouraged from caring about nature in your training. So when did the link between deforestation and disease prevalence really hit home for you? When did that sort of click in?
So when I went to my undergraduate degree, because to become a doctor in the United States, you have to do 3 or 4 years of undergraduate and get a baccalaureate degree, and then you go to medical school for another 4 years to get your MD degree. Now, when I was doing that first initial degree, I focused on biology, but in particular, environmental science. I also did a second major in international relations with a minor in philosophy. And my idea was to go into medicine to jointly advocate for human health and also for the environment. I had that idea from a very early stage in my education because I knew deep down that I just understood that human health cannot be separated from the health of animals and the environment. So I entered medical school in 2004, and through no fault of their own, when I would talk to my medical school faculty and tell them about my interest in nature and also human health and public health, and ask them for advice on how to create such a career, I would get a lot of blank stares. People could not, these faculty members could not really advise me in a very clear direction to go. And so I ended up taking a year off during my third to fourth year of medical school. And I spent most of that year in Uganda doing HIV and malaria research because I was already very interested in infectious diseases. And one day, out of the blue, when I was in Uganda, I received an email from my old mentor from my undergraduate studies, who was a marine biologist, because I used to do marine biology research. And she sent me this paper that had just been published in the journal Nature that looked at trends in emerging infectious diseases. And this paper showed that infectious diseases are increasingly emerging around the world, and that most of these new infectious diseases are the result of spillover, meaning that these new infectious diseases are caused by pathogens that start in animals that then jump over into people.
The name of that study is Global Trends in Emerging Infectious Diseases, published in February 2008.
And that was the light bulb moment for me. That was my epiphany, because I finally saw how I could bring all of my interests from public health and clinical medicine and conservation all together in a career through fighting emerging infectious diseases, which is what convinced me that I should join the CDC after I finished my training.
Thanks for tuning in to listen to the first few minutes of this podcast. To hear the full conversation, find the Mongabay Newscast wherever you get your podcasts from and click subscribe. You can also get each new episode straight to your inbox by subscribing to Mongabay's weekly newsletter at mongabay.com. And if you really want to support us, you can donate to our Patreon at patreon.com/Mongabay. Thanks for listening.